Given the patient is young, fit, and likely to tolerate side effects better than later, he is a good candidate for treatment intensification. Before making any treatment decisions for our patient, it's important to understand the key clinical data supporting each option. So within the first-line mCRPC setting, there are 3 phase 3 trials that actually look at the combinational treatment approach of PARP inhibitors and ARPIs. Those trials are called the PROPEL trial, the Magnitude trial, and the Part-2 trial. Primary endpoint of all these 3 trials was radiological progression-free survival. Unfortunately, in the Magnitude trial, the cohort with non-HR altered status was stopped early due to futility analysis. Remarkably, both the Part-2 trial and PROPEL met their primary endpoint with a significant improvement for the all-comer population with hazard ratios of 0.66 and 0.63. Interestingly, and in line with the hypothesis of BRCAness, in both trials, also the non-HR deficient patients did benefit from the combinational treatment approach of ARPI and PARPi in HR non-deficient patients. When selecting treatment for metastatic castration-resistant prostate cancer, it is essential that physicians understand the treatment goals of their patients. Key considerations include maintaining quality of life, effective symptom control, balancing benefits and toxicities, achieving disease control and prolonging survival, respecting the patient's preferences and values. A key part of this understanding includes the adverse events associated with these treatments. The patient has expressed 2 key concerns: attending his daughter's graduation in 3 months and minimizing the side effects that could impact daily life. Looking at the safety profiles of the combinational treatment approaches of PARPi and ARPI, fatigue, anemia, nausea, and hematological toxicities were among the most reported. Most AEs were managed easily by supportive care approaches, as well as dose interruptions and reductions. After the patient was initiated on the combinational treatment approach with abiraterone and olaparib, he did very well. Only mild side effects like a very low-grade anemia and some fatigue symptoms were reported. A CT scan in September 2024, as well as a follow-up scan in February 2025, showed a stable disease, while the PSA was decreasing rapidly during the course of therapy. In fact, the patient was able to attend the graduation party of his daughter within good health and with good quality of life. Today, we discussed the importance of shared decision-making using the SHARE 5-step communication framework to enhance physicians-patients interactions. We reviewed clinical data from PARPi and ARPI trials, noting that some combinations are effective in both molecularly selected and unselected mCRPC patients. Through our patient case, we saw first-line treatment intensification can lead to a positive outcome. Importantly, a treatment decision is a very individual decision, and personal goals need to be taken into account, as well as efficacy and potential side effects for each patient.